Good morning. Hello, my name is Elizabeth Kouaovi, and welcome to the WHO Africa Media Briefing, which is taking place in collaboration with the APO Group. First, some housekeeping. You can choose the language of your choice to listen to the press conference by turning to the globe on the bottom right of your screen and select your language. Bonjour, je m'appelle Elisabeth Kouaovi, bienvenue à ce point de presse de la région Afrique de l'OMS qui se tient en collaboration avec le groupe APO. Quelques questions pratiques. Tout d'abord, vous pouvez choisir la langue de votre choix en cliquant sur le globe qui se trouve en bas à droite de votre écran. Joining us from Brazzaville, Congo, is Dr. Matshidiso Moeti, WHO Regional Director for Africa, and I will now let Dr. Moeti to introduce our other panelists. Dr. Moeti, you have the floor. Good morning.
Thank you, Elizabeth. Good morning and good afternoon, bonjour, and welcome to all the journalists joining this press conference about COVID-19 and Africa's health workers. I'm very pleased to be joined by Dr. Apesiani Yawa, the coordinator of the Technical Working Group for the Deployment of COVID-19 Vaccines of Togo. Bonjour et bienvenue, le Dr. Yawa, who's going to speak about Togo's success in rolling out COVID-19 vaccines to health workers. I believe we'll also be joined by Mr. Michael Ekuma Nachi, who's the national president of Nigeria's National Association of Nurses and Midwives, and he will provide a perspective on the challenges that health workers face in terms of COVID-19 vaccination. Again, bonjour, good morning, afternoon, and welcome to both of you. There have now been more than 8.6 million cases of COVID-19 and about 221,000 reported lives lost due to the pandemic in Africa. While new cases have plateaued in the last 2 weeks following a peak in August, Africa must remain on high alert as we see cases rising across Europe. We are also about to start the end of the year travel and gatherings and celebration season, which triggered a surge last December. We're already seeing an uptick in new cases in Southern Africa, with a 48% jump in new cases compared with the preceding week. This comes after 18 weeks of sustained decline, with the increase driven mainly by a spike in cases in South Africa. We know that vaccination is our best defense, but while many high-income countries report more than 60% vaccine coverage, just over 7% of Africa's population is fully vaccinated in spite of a rise in shipments of doses to the continent recently. Crucially, preliminary analysis finds the majority of health workers are not benefiting from optimal protection, leaving them dangerously exposed to severe COVID-19 infection. This puts at risk not only their own health and well-being, but also that of the patients that they look after. The WHO analysis, based on data from 25 countries in Africa, finds that only just more than 1 in 4 health workers, or 27%, are fully protected. Meanwhile, a recent WHO global study of 22 mostly high-income countries reported that over 80% of their health workers are fully vaccinated. The risk of health worker infection increases whenever cases surge, and with a 4th wave looming, countries must urgently speed up the rollout of vaccines to those on the front lines. While the continent is gradually overcoming vaccine supply constraints, it is critical to fix other issues. The low coverage among health workers is partly due to the unavailability of vaccine services, especially in rural areas. Vaccine hesitancy is also a challenge. Recent studies found that only 40% of health workers intended to receive the vaccine in Ghana and less than 50% in Ethiopia. Concerns over vaccine safety and adverse side effects have been identified as the main reasons for their hesitancy. As WHO, we are supporting national efforts to escalate health worker vaccination by coordinating trainings and dialogue around vaccine safety and efficacy to to also help address any doubts or misconceptions, as well as advocating for open and honest communication about the benefits and side effects of vaccination. But we also appeal to all the relevant professional unions and associations to assist us by focusing on enlightening their members about the importance of getting vaccinated against COVID-19. In Cote d'Ivoire, for instance, WHO is supporting that country's Pediatricians Association with sensitization and training interventions, the most recent of which took place on the 18th of November. In Ghana, we've supported advocacy drives by the Ghana Academy of Arts and Sciences and collaborated with the Ministry of Health to engage a range of professional organizations, including Health Services Works Union, the Ghana Registered Nurses Association, and the Pharmaceutical Society of Ghana. Health workers are ensuring that our hospitals, clinics, and community health centers keep their doors open, not only for COVID-19, but to manage a wide range of other health challenges. Africa already suffers from a shortage of health workers. Only one country in the Africa region, the Seychelles, has a requisite 10.9 health workers per 1,000 people to deliver essential services, while 16 others have just one health worker for the same number of patients. The countries with the lowest health worker population ratio include Benin, the Central African Republic, Chad, Madagascar, and Niger. Therefore, even one unnecessary COVID-19 infection is one too many among our health workers. I'd like to take this opportunity to pay tribute to all of our dedicated nurses, doctors, laboratory technicians, cleaners, and community health workers for their invaluable contributions, and to encourage them all to get vaccinated as soon as doses become available. Welcome again to this press conference, and I look forward very much to today's discussion.
Please unmute yourself.
Thank you very much, Dr. Moeti. Je me tourne à présent vers, merci beaucoup, Dr. Moeti. Je me tourne vers le Dr. Apetiani. Dr. Apetiani, est-ce que vous pouvez nous expliquer comment est-ce que le Togo a réussi à vacciner la majorité des agents de santé? Comment est-ce que votre pays a pu relever les défis qui se posent? Et dans quelle mesure est-ce que le Togo peut constituer un exemple pour le reste de la région africaine? Docteur Apetiani, vous avez la parole.
Merci beaucoup. Bonjour, merci. Bonjour, Madame la directrice régionale. Donc, il faut dire qu'au Togo, la campagne de vaccination a été lancée le 10 mars 2021 par le Premier ministre. Et à la suite de ce lancement, la campagne a commencé par le personnel de santé et assimilé, et des secteurs publics et privés, notamment le personnel soignant, les agents de santé communautaire, les apprenants des écoles de formation clinique et paraclinique et le personnel du système des Nations Unies. Et il faut dire que c'est ce personnel de santé qui est en première ligne pour la riposte et nous avons commencé par ce personnel de santé. Et avec la vaccination du personnel de santé, la couverture globale au vaccin AstraZeneca est à 93%. Donc, nous avons eu une couverture vaccinale globale de 93%. Maintenant, comment nous avons pu vacciner? Comment nous avons fait pour vacciner la majorité du personnel? Nous avons eu des séances, plusieurs séances de sensibilisation avec l'implication personnelle du ministre en charge de la santé du Togo. Nous avons impliqué également des personnes ressources comme les membres du comité scientifique, du conseil scientifique, les enseignants des écoles des sciences de santé. Donc, l'université de Lomé a été impliquée. Donc, la faculté des sciences de santé a été impliquée. Nous avons impliqué également les organisations professionnelles et les syndicats. Donc, tout ce monde nous ont aidés à sensibiliser le personnel de santé à adhérer à cette vaccination. Il y a eu également en amont l'organisation d'une formation en ligne à l'endroit des acteurs de la santé sur la COVID-19. Donc, au cours de cette formation, donc, les différents types de vaccins ont été présentés. Leurs effets secondaires ont été présentés, de même que comment faire pour juguler ces effets secondaires liés à la vaccination. Le ministre de la Santé a présidé aussi personnellement une rencontre avec tous les acteurs du système de la santé, les directeurs centraux, les directeurs régionaux, les directeurs généraux, les directeurs des hôpitaux, les directeurs préfectoraux de la santé, afin de les inviter à adhérer massivement à la campagne de vaccination et à propager autour de l'information dans leurs structures sanitaires afin que la majorité du personnel de santé adhère à cette vaccination. Il faut également dire que le lancement de notre campagne avec le Premier ministre qui a reçu sa première dose, qui a reçu en premier sa première dose de vaccin AstraZeneca, et avec la médiatisation qui a suivi, ça aussi, ça a rassuré le personnel de santé pour leur adhésion à cette vaccination. Il y a aussi l'enrôlement des agents du système des Nations Unies ou les représentants de ces agences-là, pour citer l'OMS, l'UNICEF, le PNUD, ils ont adhéré à la vaccination, ils ont eu aussi leur vaccination, donc cela a aussi incité le personnel de santé à l'innocuité de ce vaccin. Il y a aussi une préparation et une coordination logistique qui est bien huilée, donc pour assurer une disponibilité permanente des vaccins dans les 6 régions sanitaires au niveau des 39 districts sanitaires. Et pour pouvoir atteindre aussi le personnel de santé, nous avons combiné plusieurs stratégies. Nous avons utilisé les stratégies FIS dans les formations sanitaires et les équipes aussi se sont déplacées vers eux dans leur formation sanitaire pour pouvoir les vacciner. Comment nous avons fait pour surmonter les défis? Donc, c'est le renforcement de la mobilisation sociale à travers des émissions radio et télé. Nous avons eu à organiser également des dialogues communautaires dans la communauté. Nous avons fait des sensibilisations par les véhicules sonorisés afin de dissiper les rumeurs liées à la vaccination contre la COVID-19 et amener toute la population à adhérer à cette vaccination. Il y a eu également la formation des spécialistes des médias pour aider dans le relais de la bonne information. Donc, il faut donner la vraie information à la population et nous avons eu à former ces spécialistes des médias également. Nous avons utilisé également les réseaux sociaux pour diffuser les informations et informer la population. Il y a eu également la mise en place d'une équipe de communicateurs pour le tracking et la gestion des fausses informations, pour la gestion des rumeurs. Donc, il y avait une équipe qui se chargeait de recevoir, de collecter les rumeurs, de les traiter et maintenant d'apporter d'autres informations réelles à ces rumeurs-là. Et aussi, il y a aussi le gouvernement aussi qui diffuse des communiqués incitant la population à aller se vacciner. Et il y a aussi des communiqués qui disent qu'il faut montrer son passe vaccinal avant d'avoir accès à certains bâtiments publics. Ça aussi, ça nous a beaucoup aidé. Donc, pour le partage d'expériences, c'est ce que nous faisons déjà. C'est ce que nous sommes en train de faire à cette conférence de presse. Donc, partager l'expérience du Togo avec les autres pays. Donc, et aussi, à travers les réunions de l'OAS, partager ces expériences-là avec les autres pays. Je vous remercie.
Merci infiniment, Dr. Apetiani. It seems that our speaker will join us, the second speaker will join us later. So without too much ado, we're going to give the floor to the journalists for questions. We have a question from Noma. who's going to ask the question live. Noma, are you online? Are you on the call from Hesitancy?
Yes, I'm here. Good morning.
Good morning.
Yes, I have a question basically around the new variant that South Africa has detected and wanted to find out if WHO Afro has been given the heads up because it seemed that there's been like a serious bout of flu doing the rounds in the country, and now it's being attributed to this new variant.
Thank you for your question. Before I give the floor to Dr. Moeti, allow me to tell you that we have experts with us, Dr. Amigo, Dr. Balde, and Dr. Nixie, who are with us, and will probably add more information to what Dr. Moeti will have to say. So Dr. Moeti, you have the floor.
Yes, thank you very much for that question. So I will start and then I'll ask our colleague Nixie Gumede to supplement. Indeed, we have become aware of what WHO is calling a variant under monitoring. This information came out yesterday, which is called the B11.529. About which we will, of course, need to get more information from the countries concerned, both South Africa and Botswana. We are interested to find out to what degree the countries are finding this virus is circulating. This is very new, latest information. Of course, we are also interested to learn more about the characteristics of this virus. Apparently, there is concern that it has a high number of mutations in the spike protein, which might have implications for how infectious it is, and therefore simply mean that all the measures that are being carried out have to be reinforced even more. And I think just speaks to the urgency of rolling out the vaccines to particularly those people who are most vulnerable. So Nixie, perhaps you'd like to add any information, additional information you might have on this.
Thank you so much, Dr. Moeti. Yes, I think a few hours ago, we had a meeting with the laboratories both in South Africa as well as in Botswana, also discussing the same issue related to B1529. Currently, it's been an issue, and then I think both laboratories, they'll be sort of like briefing the ministers of the government earlier, I think at this time or maybe later today. And I think there's still a lot of investigation that is ongoing, and the concern is based on the high number of mutations, as Dr. Moeti mentioned earlier on, that has been observed in this new variant that was sort of like designated as a variant under monitoring yesterday by WHO. So as you know that once we've got that high number of mutation, especially in the spike protein, we know that that might even affect the virus ability to infect the cells and also the spread of the virus itself. And it might even make it harder for the immune cells to be able to attack the virus. So there's quite a lot of investigation and research that is going on. And then I think there is a more information that is going to be coming up during the briefing of the governments from both countries today. And then what we can say that up until we've got further research findings from the laboratories, I think that we're going to have a better information to share with the journalists. However, this is quite a concern globally, and also it's quite a concern, especially in the southern part of the continent. As you know, that one country that is being infected here due to our high population movement, and also now approaching the December holiday where people are going to be going back to their homes, that might be a serious concern related to the infection from one country to another. So we're going to keep you guys being informed of the latest information coming from these particular laboratories. And then these are the head of labs that we are speaking to them this earlier on this afternoon. So in relationship, as you have mentioned, that it might be linked to the previous flu sort of like situation that was taking place. So far, there hasn't been any data that has been shared with us as WHO if there is any correlation or any relationship of what has been happening with the severe influenza season that took place in South Africa in connection with the variant of that has just been reported yesterday by the both countries. So over to you. Thank you so much.
Thank you very much, Dr. Gumede. If there is no more information, details that on that question, we can ask another question from Maggie at Reuters, who's asking, is COVID-19 supply beginning to outpace the demand in some African nations? And if so, which African nations, aside from South Africa and Kenya? So I'll give the floor again to Dr. Moeti, and the experts can also come in later, including Dr. Afechani, if she wants to add more to what Dr. Moeti will say. Dr. Moeti?
Okay, thank you very much. After months of huge challenge in getting sufficient vaccine supplies, we're seeing now an acceleration in the availability of vaccines in African countries, and observing different rates of being able to absorb and use these vaccines by other countries. There's been a lot of work done by the countries with support from WHO and other partners to prepare, both in terms of the logistics, the cold chain, the human resources, the financing, and of course, the preparation of the population to absorb these vaccines, and to make sure that we are targeting the most vulnerable people first, and then expanding to other groups. We are starting to see some countries indicating that they need to work further to distribute the vaccines that they've got, and showing what we think is a very reasonable reluctance to acquire vaccines and then to risk those vaccines expiring because they are not able to roll them out. So I will turn it over to Richard, just emphasizing that, of course, our wish is to support the countries to ramp up their readiness as soon as possible, so that we do not miss the opportunities to vaccinate people and catch up in terms of the coverage of the population, particularly now if there are even new variants emerging, but really just to catch up with the rest of the world in Africa, normalize life, and have economies and other sectors of development start to recover. So Richard, perhaps you can give some additional information where it is that the challenges are greatest and what we are doing with partners to support countries.
Yeah, thank you very much, Dr. Moeti. Yeah, indeed, indeed, we have had countries that have started to receive, since now a few weeks, an important number of supply. But overall, when we looked at the data, and particularly the last 6 to 8 weeks, we have realized that we have 30 countries in the region that were able to administer more than 80% of the doses that they've received, which is quite a very good performance. And we have additionally 20 countries that have been able to administer between 50 and 79% of the vaccine that they've received. Only 2 countries, the Democratic Republic of Congo and Djibouti, were not able to administer more than 20% of the vaccine. So it's true that with this situation, we have tried to assess, particularly in those countries that are not delivering all the vaccine that they've received, what could be the reasons, how can we work with other partners to support them to fast track the implementation, and that's in the provision of more doses arriving. So all in all, we have now mapped out all the countries with issues, bottlenecks that are hampering vaccine delivery, and working first of all with the government, but also all the partners to support these countries moving forward. So I think in general terms, it's a very good news that we have now more supply. Now we are trying to make sure that the country are getting ready. They are even diversifying their strategy in reaching out not only vulnerable population, but we have seen also countries that have opened up vaccination even to children between 12 years and above. So a mix of variety, a mix of strategies that countries are putting in place to make sure that they can maximize the impact of vaccination using the supply that are becoming now more available. Over.
Thank you very much, Dr. Ningo. Docteur Apetiani, quelle est la perspective du Togo sur cette question, sur le fait que l'approvisionnement en vaccins commence à dépasser la demande en vaccins? Quelle est la perspective du Togo là-dessus?
Merci beaucoup, Elisabeth. Donc, jusqu'à ce jour, le Togo a reçu plus de 4 millions de doses de vaccins, donc précisément 4 316 000 doses de vaccins. Et nous avons utilisé 1 600 000. Donc, environ plus de 35% de vaccins ont été utilisés. Donc, il faut dire que jusqu'à ce jour, nous n'avons pas de problème de stock de vaccins. Et actuellement, même, nous sommes en cours d'organiser une campagne accélérée de vaccination au cours de 15 jours pour pouvoir maximiser la consommation de ces doses de vaccins. Et il faut préciser qu'au Togo, nous utilisons 4 types de vaccins. Le vaccin AstraZeneca, le Pfizer, le Johnson & Johnson et le Sinovac. Merci beaucoup.
Merci, merci beaucoup. Now we have a question from Ocheng at SciDev. The question is, given that only 1 in 4 health workers are fully vaccinated, what are some of the initiatives, the things that can be done or needs to be done to have the majority of health workers vaccinated and covered? I would like to ask this question to Dr. Moeti, and then maybe Togo can come in and Dr. Minigo. What needs to be done so that we can cover all health agents?
Yes, thank you. That's a very good question, and it's an urgent matter. Clearly a variety of strategies will be needed, both to create the demand among healthcare workers and to be able to deliver the vaccines to all health workers wherever they are. I think I said in my statement that to some degree, particularly out in more rural areas, the services were simply not available as the vaccine rollout plans and systems were being developed in countries. So it's very important if now we're going to be able to reach all the healthcare workers, not only to be able to reach the ones that are in urban areas who, of course, may be among the majority of healthcare workers, but to be able to reach healthcare workers everywhere means decentralizing, expanding the number of sites where vaccines can be developed to be able to reach health workers everywhere in countries. And this will go along, of course, with accessing them and vaccinating them as being among the highest priority groups, together with elderly people and people with comorbidities. So it needs a special effort to ensure that we reach out where the health workers are. And then secondly, a very strong effort to mobilize health workers, a demand among them to be vaccinated. As I said in my statement, we are working and will increase our work with different associations, those who can influence healthcare workers. It is necessary also that the employers of health workers, both the ministries of health, the governments that employ a large number of health workers, but we know many health workers are also working in the private sector, are working in some academic training hospitals. So there are different ways of reaching people through their associations, through their employers and workplaces. And what is important is to address whatever reasons are causing the reticence to be vaccinated. So not only people's doubts about efficacy, people's doubts about side effects and safety, understanding that this is important for health workers themselves, but also they are providers of information to the population as well. So we must find ways to hear, understand the reasons for their hesitation, and then ensure that we reassure them and work with other health workers who've been vaccinated to be part of the process of reassuring them. Richard, perhaps you'd like to add some other suggestions. Oh no, de Togo à qui on va demander comment nous pouvons travaillé pour accélérer. Qu'est-ce que vous avez fait au Togo? Vous nous avez expliqué ce que vous avez pu faire. Je vous passe la parole.
Ok, merci. Au Togo, comme je venais de le dire, donc c'est la communication. Nous avons renforcé la communication auprès de ce personnel de santé pour leur forte adhésion. Et Monsieur le ministre, même le ministre en charge de la Santé, s'est personnellement impliqué. Nous avons impliqué les organisations professionnelles et syndicales des personnels de santé, les membres du conseil scientifique et même les enseignants des universités qui nous ont aidés à communiquer avec le personnel de santé et à les rassurer sur l'innocuité de la vaccination. Donc, c'est ce que nous avons eu à faire. Merci.
Dr. Migo, do you have something to add to the strategies?
Well, no, I think Dr. Moiti eloquently, I think, said it very well. Just to add that this indeed is not an issue that is peculiar to the African region. I think although elsewhere in other regions we have seen quite a very high coverage of vaccination of healthcare workers, we still have this resistance even within the professional bodies on the people who are supposed to know better how vaccine works. But I think most of the strategies that Dr. Moite highlighted, I think we are trying really to see how this could be getting down, particularly for those healthcare workers who are working in the peripheral level. I think this is very important to make sure that the people who are working in remote areas are equally reached by this new strategy. Otherwise, I think we are putting in place all the efforts to make this really a priority in minimizing the risk of contamination for this very, very important group of stakeholders.
Thank you very much, Dr. Migo. Another question comes from Mrs. Merab from Kenya. Vaccines are now available. They are available in many countries, in African countries, but we still see that vaccination coverage is grossly low, at just 6.6%. Some countries like Kenya threaten to withhold government services for people who would not have been vaccinated by December 2021. Now, is it time for countries to impose vaccine mandates to overcome this challenge? Dr. Moiti, if I may.
Our observation is that the coverage rates in our countries, because there's been a delay, as we said before, it is relatively recently that we're starting to see increases in the availability and the delivery of vaccine supplies in countries. And of course, then the campaigns must be undertaken to reach the populations, starting with the most vulnerable. So at this level of coverage, on average, less than 10% of the population covered due to mainly the delay and also partly to people refusing to be vaccinated, hesitating. It would be good to balance the approaches of persuasion, information sharing, expansion of the capacity to deliver, intensification of the campaigns, as well as then using that additional tool of further motivating people to be vaccinated because they need to get services that they need. I think different countries will take these decisions at their own time. We would like to really see the vaccination coverage reach a significant level, which is not yet the case, well, at less than 10% in many countries in the region. But at the same time, at some point, all of us have to take responsibility for ourselves when we've had all the opportunities, when we've had all the information that it's necessary, then need to take that decision, because not only is it a decision for us as individuals, but it's also a collective. I think just to remind that, you know, if we are refusing to be vaccinated, we're endangering not only ourselves, but our communities, our countries. So there is a sort of expectation of that contribution to our common good, and which is why then some countries are imposing these vaccine mandates. But I think they should importantly go along with the availability of opportunities to be vaccinated. And different governments will decide at different levels when they start to impose these.
Thank you very much, Dr. Moiti. Before I jump to another question, it seems that our third panelist has joined the call. Is Mr. Michael, are you there? Are you on the call? No? Okay, while we try to connect the third panelist, I will ask you a question, Dr. Oh, are you Mr. Michael Ekuma? Good morning and welcome to this press briefing with Dr. Moiti. You are on mute. Sorry, you are on mute. Okay.
Yeah.
Now.
Good morning, every participant from all over the world for this very important interaction. I use this opportunity to also welcome you to the forum. And I believe that by the time we finish with this interaction, we should be able to make impact so that many people who have not up till now seen the need for the vaccination, we see the need through our support education and other available information that can be made to get the public generally involved. Thank you. I think I will have opportunity to speak more. Thank you.
Yes, definitely. And thank you for this call for vaccination. So let me turn to Richard. I have a question for you, Dr. Migo, in French. Je suis Marthe Bossoan-Dolé de l'agence France Presse à Kinshasa. Et je pose cette question. Les responsables de la lutte contre la COVID-19 ont dernièrement indiqué que le taux de vaccination de la RDC était le plus bas, avec 1% de couverture vaccinale, donc le plus bas au monde. Qu'est-ce que l'OMS Afrique peut faire comme commentaire sur cette situation? Et est-ce qu'on va continuer à envoyer des doses de vaccins dans ce pays où, manifestement, la couverture vaccinale contre la COVID-19 a du mal à décoller? Docteur Migo. Et bien sûr, Docteur Moiti.
Oui, merci beaucoup, Madame Kouaovi. J'ai eu l'honneur, il y a environ un mois, d'accompagner la directrice régionale, Dr. Moiti, à Kinshasa pour le deuxième forum national sur la vaccination de routine et l'éradication de la polio. Dr. Moiti a pu rencontrer les hautes autorités en RDC et bien entendu, la question sur la vaccination COVID a été largement discutée. Nous avions également une équipe que je coordonnais qui était censée travailler. On a discuté longuement avec les autorités nationales sur la stratégie de comment changer les choses en RDC. Je peux dire que après la visite, non seulement de l'OMS, mais on était accompagné par beaucoup d'autres partenaires en RDC. Et après des échanges vraiment honnêtes, fructueux avec les autorités nationales, un plan de relance de la vaccination COVID a été finalisé pour la RDC avec comme objectif principal de commencer par la vaccination dans Kinshasa, mais également dans le Nord Kivu, comme deux premières provinces où nous avions beaucoup de cas, mais également la morbidité et la mortalité de la maladie étaient assez élevées. C'est un plan solide qui a été discuté avec les autorités, qui a eu les inputs de tous les partenaires sur le terrain. Et nous pensons que si ce plan, qui est d'ailleurs, qui commence à être mis en œuvre et mené à bien, nous allons certainement voir les choses changer. Une deuxième chose importante, il y a une semaine et demie, il y a eu un forum ou une table ronde nationale sur la vaccination de COVID. Et cette table ronde a été présidée par le Premier ministre lui-même. Et on a vu le Premier ministre prendre publiquement sa deuxième dose de vaccination. Donc, il y a eu certains gestes très forts, y compris le président de la République lui-même lors de notre visite avec la directrice régionale qui avait pris sa deuxième dose de Covid, qui crée quand même un espoir de voir les choses changer au niveau de la RDC. Toutes les contraintes, les problèmes qui avaient freiné la vaccination ont été largement analysés, des solutions ont été proposées et nous espérons que les choses vont certainement changer. Il y a une deuxième phase qui va commencer au début de l'année prochaine sur toutes les autres provinces. Il y a des ressources qui ont été planifiées dans ce cadre-là et nous avons mis en place, en collaboration avec nos collègues du ministère de la Santé en RDC, un plan de suivi très strict pour monitorer la mise en œuvre de toutes ces nouvelles étapes. Donc, nous travaillons réellement en étroite collaboration avec les autorités pour faire changer les choses en RDC et nous espérons que ceci va porter ses fruits dans les jours et les semaines à venir.
Merci. Thank you very much, Dr. Amigo. I don't know if Dr. Moiti wants to add anything to this?
No, I don't know. I don't want to add anything. I mean, just to say that indeed the leadership demonstrating themselves being vaccinated, I think is a very strong part of the motivation, communication to the public. And then I believe it's very important, and it's part of the plan, no doubt, the communication with people at the local level, in their own associations, through various means, through the churches, through different clubs, associations, young people who are organized. We believe strongly that reaching people through carriers of the message that they trust, people with whom they associate in their normal life, in simplified language that addresses what people are concerned about. And just to add that we have an initiative, the infodemic response, where we monitor what it is that is being said, being speculated about, being shared through the social media, and ways to address these concerns or bits of misinformation will be for sure part of what we help the government to do in the DRC.
Thank you very much, Dr. Moeti. Mr. Mnachi, Michael, let me turn to you and ask what is your perspective and opinion on the reasons why healthcare workers are reluctant to get vaccinated against COVID-19?
Well, I think it has come to the time I have to say something that are very, very important. The issue of response of people to accept taking of COVID-19 has become very important because it has been crowded with misinformation here and there that we need to do a lot of education. Number one is that the health workers, the nurses and midwives, possibly through the National Association of Nigerian Nurses and Midwives, need to be carried along and get involved in the exercise. In the course of that, there will be health education, whereby a lot of information will be given to counteract misinformation that is circulating here and there in the social media. There is every need that both the health workers and other stakeholders and the general public generally need to participate in this vaccination exercise. But then a lot of issues are there that require education. So if the nurses are directly involved from the area of distribution of the vaccines, and then issue of getting involved in giving the vaccination themselves. Through health education, many people will be convinced of the need, so that those who are sharing information from the social media, which are actually not the truth, will also have the other side of the story and they have the correct information. So primarily, if the nurses are directly involved, we can achieve more. And more so, there is need to encourage other developing countries to continue to develop and produce these vaccines, considering the number of people generally. So basically, the direct involvement of the nurse and midwife is very important. For the government of Nigeria, they are doing so much, doing excellently well concerning issue of making available the vaccines, and then to the areas where they are needed. They are putting a lot of effort, but more needs to be done through health education, basically, because the information people get from social media is more or less confusing the general public. So that all of us as health workers, we go through the grassroots and ensure that people have the correct information, so that a lot of people, especially those who have not up to before now gotten vaccinated, they should get vaccinated, because all it's to protect mankind. Vaccine is not a new thing. Other dangerous diseases have been protected through the use of vaccine. So, and it's not different from that of COVID-19 pandemic. So we encourage other countries to see reason to use health education in the general public, so that everybody will respond to that need.
Thank you very much, Michael.
And then this type of meeting is also very important, so that from time to time we have need to interact to know what is happening in different countries, and then we provide a way forward. Thank you.
Thank you very much, Michael, for these very useful insights. Let me turn to Dr. Balde. Dr. Balde, this is a question from Reuters, from Duncan. Can you please give us an update on Africa's approach to the American Pfizer treatment pills? Has the continent or individual countries ordered these pills? And if yes, when do you think these shipments are supposed to start coming on the continent, Dr. Balde?
Thank you, Elizabeth. Thanks for the question. Yes, we've been in interaction with almost 9 countries here in the region, which has expressed a kind of need, for getting some of these specific drugs against the COVID-19. And those ones are mostly countries like Uganda, Tanzania, Ghana, and Ethiopia, and also Malawi and Nigeria. But those ones are really related to the drug which is called the tocilizumab, which is mainly produced by Roche. But the other drugs which are currently produced by Pfizer and Merck, those are really the monoclonal antibodies. There's no really that much of, demand which has came, to WHO for a kind of support. So I think there are currently some interaction also for this newly, mentioned drug, the antiviral drug called like molnupiravir, which has been produced also by Merck. To try to really to see how far can we really increase the access to all of these specific drugs in the region here. But at the meantime, as we know, there are also other means which can help, people to get more, treated. Those are all of these corticosteroids. So we are supporting countries, to really get access to these drugs. But at the meantime, I would like just to mention these, balance that we need to do between, the specific drug, which might be quite well expensive for our countries, to find the mechanism for supporting, the access to those drugs, and also the ones which are currently available, like the corticosteroid, but also all of the oxygenotherapy that is really required, for saving lives, especially for the mostly severe and critically affected patient by the COVID-19. Thank you, and back to you, Elizabeth.
Thank you very much, Dr. Balde. I would like to go to another question now by Janice from Bloomberg, and this is to Dr. Binigo. Richard, we heard yesterday that South Africa asked Johnson & Johnson and Pfizer to suspend delivery of COVID-19 vaccines as it seems that the country has enough stock. Does WHO know if these stocks are now being directed to other countries, African countries, and how concerning is this in light of the new variant that is circulating in South Africa and in Botswana, along with rising infection rates that we are experiencing now? Dr. Mungo.
Thank you, Elizabeth. Let me first start by maybe if we should put these numbers into perspective. If we looked at the data in South Africa from the last 4 to 6 weeks, I think South Africa has done very well. They've received around 25 million doses. And out of those 25 million doses, almost 98% of these doses were used. So far, we had at least 41% of the people who have received at least one dose. And the latest data is showing that between 25 to 30% of the population have received already 2 doses. So I think quite some very good performance, and we are still working with the country to see how even that could be even further increased. Now, with the recent delivery, I think it's just normal the country have received quite a lot of supply. So they are really, again, planning very well how to strategically use these new supply that have arrived. And I think by asking to put on hold, this is maybe the right expression we can put, of the new supply, I think it's just normal that they are trying to see how to plan for the use of the vaccine that are now in the country. So it's very difficult to say if the excess number of doses that were supposed to come to South Africa will have to go to other countries. But I think we have a system in place through either the African Union-led initiative, the AVAT, or through the COVAX initiative that is looking at vaccine allocation country by country in line with the consumption rate. So clearly these doses, these excess doses are not going to put at idle. They're going to be definitely redirected where there is a great need for the moment. And I think we should consider this the situation in South Africa as a normal situation. When they have excess supply, they try to put in place plans to roll out this supply while seeing the pipeline in the future. Over.
Thank you very much, Dr. Migo. I now have a question about vaccine hesitancy that goes to Dr. Moeti and Dr. Akuchani. So, to what extent is vaccine hesitancy contributing to slow vaccine rollouts? And do authorities have a good understanding of what lies beneath this hesitancy, particularly among health workers? This is a question from Lindsay, New York Times. So, Dr. Moeti and Dr. Akuchani, you have the floor.
Yes, I mean, there's no doubt that vaccine hesitancy is a factor in the rollout of vaccines, and it is a factor, as we've said, including among healthcare workers. So some surveys that have been done have discovered that in some countries, quite a reasonable proportion of healthcare workers still are hesitating about these vaccines. I think we have to understand several things. You know, if I look at the situation of vaccine acceptance in Africa before, there's been a good level of vaccine acceptance for under 5 children. Traditionally in African communities, people have been very willing, where the opportunity exists, to bring their child to get the usual childhood vaccinations. And I think we also have to acknowledge that getting vaccinated as adults in such large numbers, apart from when you are traveling for yellow fever, is a very, very unusual experience. And the vaccines that are being used are vaccines that are being very quickly developed at the global level. And there has been a lot of communication about these vaccines, both promoting them and some misinformation, sometimes information that has had to be shared with the public as part of developing a new vaccine, when there have been observations of certain side effects. What has been unfortunate when these side effects have been discussed, for example, blood clotting, is that quite often people lose sight of the big picture, that these are very rare events, that among millions of people that have been vaccinated, you may get a very small number that has a side effect that gets picked up and gets talked about, and some people become afraid. And then in addition, there is, we know, a certain community of people who are against vaccines for whatever reasons, ideological and other reasons, who have become very active in the context of vaccine being such a key tool in the response to the COVID-19, and have spread a lot of information around vaccines that is not true, that is discouraging people. And then there are other beliefs that have emerged. So, you know, people and then healthcare workers are also people that may have their own beliefs, and the influence of the spread of misinformation, the concerns about initial information about side effects, safety, has affected the situation. What is very important is really to get an understanding of what it is that people are exchanging as information, to get this knowledge, and to find ways to address the incorrect information, the fears, the worries, in such a way that we reassure people, and particularly healthcare workers, that it is safe and it's important for them to take every opportunity to be vaccinated for their own sake and for the sake of their families, communities, countries, economies.
Thank you, Dr. Moeti. Dr. Alpeciani, je vous pose la même question. Selon vous, dans quelle mesure cette hésitation vaccinale freine la vaccination des professionnels de la santé? Et selon vous, quelles sont les raisons qui expliquent cette hésitation vaccinale?
Merci. L'hésitation vaccinale, c'est principalement dû à la peur de l'inconnu et à la peur des effets secondaires des médicaments ou bien des vaccins. Donc, avec l'implication des autorités, l'implication des ordres des médecins, des ordres des pharmaciens et de l'association des médecins privés du Togo dans la sensibilisation, cela a rassuré le personnel de santé et a dissipé ces hésitations et nous a permis d'atteindre 93% de couverture globale chez le personnel de santé. Et il faut dire qu'il y a aussi un fort engagement politique avec l'implication effective du ministère de la Santé ou bien du ministre de la Santé dans cette stratégie de vacciner la majorité du personnel de santé. Merci.
Merci beaucoup. Merci. Two quick questions to Richard, Dr. Mingo. One from Punch newspaper from Kolawole Deborah. And the question is, what is the exact statistics of Nigerian health workers that are not vaccinated, and what is the general reason for not doing so? And a follow-up question by Sarah Jervin with DEVEX. Can you give us some examples of the percentage rates by country of health workers vaccinated, and which countries are doing the worst and which countries are doing the best? So in other words, do you have data for Nigeria health workers, and who are the best examples and the worst examples? Thank you.
Yeah, thank you very much, Elizabeth. Yeah, we do have some data from Nigeria. I think the data that we have from Nigeria shows that around 18% of the healthcare workers are currently fully immunized. This is a projection from the total number of healthcare workers that we are projected in the country, which is estimated to be around 1.6 million people. And we have seen that close to 300,000, 296,133 people have received the first dose, and 520,000 people, have received the first dose, and close to 300,000 have received the second dose. So the rate is still very low, 18% only, which have been fully vaccinated, and around 30% who have received at least one dose. So in terms of the reason, I think we have discussed this extensively. most of the reasons that were provided by the regional director, and maybe our colleague in Nigeria can also provide a bit more granular information on the specific reason that hampering the vaccine rollout in that category in Nigeria. And then quickly, in terms of the countries that are doing very well, from Sarah Jerving, I think we have, as I said, a certain number of countries that are performing quite very good. A country like Lesotho, Cape Verde, Sao Tome, Rwanda have immunized almost the 100% of their healthcare workers. We have other countries like Kenya, by the way, which is doing quite very well, more than 90% of the healthcare workers based on the statistics that we had. Madagascar, Botswana, Eswatini, Zambia. I think these are the countries that are doing very well. A very interesting statistics comes from Tanzania. As you know, Tanzania started vaccination a bit late, but we have seen quite a very good penetration of vaccination within the healthcare workers. Close to 75% of healthcare workers from the data that we have are estimated to have been immunized. So on the other tail end, we have countries like Chad, DRC, Central African Republic, Cameroon, that are around less than 50% of the healthcare workers. But we can provide a bit more detail on these statistics on a need basis. Thank you.
Thank you, Dr. Minigo. Dr. Moeti, last question for you. It's from Béatrice Caz de SciDev. Dr. Moeti, dans plusieurs pays africains, certains estiment que les vaccins qui sont envoyés en Afrique ne sont pas exactement les mêmes en termes d'efficacité que ceux qui sont utilisés dans les pays développés. Et c'est la raison pour laquelle beaucoup refusent de se faire vacciner. Dr. Moeti, quel commentaire auriez-vous à faire au sujet de ces informations qui circulent? Merci.
Merci. Merci pour la question. Bon, je peux simplement dire que ce n'est pas du tout vrai. Comme nous le savons tous, nous avons eu un défi où les vaccins sont produits, et c'est un peu centralisé dans un assez petit nombre de producteurs de vaccins, et le grand effort d'élargir ça, y compris commencer à produire ces vaccins en Afrique. Donc, c'est exactement les mêmes vaccins qui sont utilisés dans les pays où ils sont produits, soit si c'est le Pfizer, ou bien le Johnson & Johnson, ou bien l'AstraZeneca. Il y a des plateformes multilatérales qui travaillent comme le COVAX, aussi le AVAT, et la donation de doses de vaccins, où nous avons accès à ce vaccin en Afrique. Donc, ça veut dire qu'il vient de mêmes producteurs de vaccins au niveau global qui produisent pour les pays développés, et aussi où nous travaillons très dur pour que l'Afrique ait accès à ce vaccin. Il y a un vaccin aussi, il y a le vaccin de Johnson & Johnson qui est produit en Afrique du Sud par le firme pharmaceutique Aspen, sur la même plateforme technique que le vaccin qui est produit partout. Donc, ce que je peux dire, c'est de rassurer nos populations africaines que les vaccins qui arrivent en Afrique ont la même qualité, la même efficacité comme les vaccins qui ont produit dans le reste du monde. Ça ne peut pas être la raison pour laquelle nous avons peur d'être vaccinés. Et il est important que nous travaillions pour diffuser ces rassurances, ces informations correctes, et assurer que l'OMS joue le rôle aussi d'inspection et de vérification de qualité de tous les vaccins qui ont distribué en Afrique. Donc, nous travaillons très dur que nos pays ont ces informations-là avant d'accepter les vaccins qui sont distribués au niveau mondial.
Thank you, Dr. Moeti. Merci, Dr. Moeti. We are coming to an end of this virtual press conference. Let's turn to our three panelists and hear any final message. You've got 1 minute each, and I will start with Michael. Michael, are you still on the call? Please, can you deliver a final message?
Once again, I want to emphasize that there is need for grassroots health education, which I know the nurses and midwives will effectively deliver. To the Nigeria government, they are doing so much. They are so committed to ensure that the general public have the vaccines reached at any level within the community and in all the states. So the government is fully committed, they are interested, and then they are doing everything possible to ensure that all the areas expected to be covered by this vaccine is reached. So my word is that from time to time, there's need to have meeting whereby different countries will report challenges and progresses made so far so that we can all continue to carry different countries together alongside. Thank you for this opportunity.
Thank you very much. Thank you. Docteur Apetiani, est-ce que vous avez un dernier message à nous adresser?
Oui, merci beaucoup. Donc, c'est dire que la planification minutieuse en amont fait par le groupe technique de travail, le suivi régulier que la cellule sectorielle du ministère de la Santé fait et le suivi des partenaires techniques qui nous appuient, en l'occurrence l'OMS, l'UNICEF, Gavi, etc., nous a permis à arriver à ce résultat et à continuer la mise en œuvre. Et j'insiste encore sur le fort engagement politique et le leadership du ministère en charge de la santé pour cette consommation, bien avoir une meilleure utilisation des doses de vaccins que le Togo a reçues. Merci.
Merci, merci à vous. And finally, Dr. Moeti, final message.
Yes, thank you. First, again, to thank all our colleagues, journalists, for having joined us. And I thank very much my fellow panelists, Dr. Apetiani and Mr. Nachi, for having joined us. And congratulations for the work that you are doing, what you are achieving. I thank my colleagues as well who have been part of the response to the journalists. So what I have to deliver as a message is that we're at a point now where the opportunity is growing every day of having access to vaccines. I'd like also to, as I thank our health workers on the continent for everything that they have done, 2 hard years of work in addressing both COVID-19 and making sure that other health problems don't overwhelm our populations, to say to them that we care about you, we would like you to be protected because we need you so desperately in the health systems of the African continent. And the governments are doing their best to acquire their vaccines. We thank those of our health worker colleagues who have gone ahead and been vaccinated. And I'd like to encourage everyone to take every opportunity to protect yourselves so that you're able to do the work, protect your families, protect our communities, and protect the very important role that you play in not only the lives of people, but in the economies of our countries, and get vaccinated. I agree very much with my colleagues. Information, addressing misinformation, misconceptions, addressing worries and fears is very important. And we'll do our best to keep hearing what it is that people are concerned about so that we address those concerns and get everybody vaccinated. That is our objective.
Thank you very much, Dr. Moeti, for these words of wisdom. This is the end of the press conference. Thank you to all panelists. Have a nice day and keep safe. Thank you. And get vaccinated.
Thank you.